Hello everyone and welcome to my YouTube channel called Med Vlogs with Nkosi. My name is Nkosazana Nkosi. Thank you so much for subscribing, liking and commenting for those of you who have. Let's begin. I decided to start Med Vlogs because I could see that I genuinely have a passion for the degree. I love the fact that it's so practical. I love the fact that it's so clinical. And I also have a knack for like creating content. So I thought I might as well merge the two together and have the ability to document and also somewhat show people the actual reality of what we do on a day-to-day basis as students alone and subsequently as clinical practitioners as well. So yeah, I'm excited for this journey. I hope that you guys can enjoy it with me, learn a lot from it. I hope it's educational for the most part. So thank you guys so much. I really do hope that the journey is endless. Most importantly, I genuinely hope that my kids can look back at this one day and see their mother for who she really was, like someone who was so hardworking, so invested in her career, and so excited to create memories that they could one day see and possibly recreate them as well. So the first video that I'm posting is a 24-hour call video. So a 24-hour call video is essentially working for 24 hours, no sleep. And I mean it when I say no sleep. Like in the morning, by the time it's time to like clock off, you notice that I shall zone out from time to time. The 24-hour calls consisted of 3 main rotations. It was casualty, it was emergency and trauma, and it was theater. In the video, I'll also be explaining like certain things that we do, certain procedures, how to do the procedure step by step, so you guys can actually understand what is going on. So I think we'll end the intro there. Thank you guys so much for tuning in. Please enjoy the entire experience. I know you guys are gonna love it. I know you guys are gonna have literally a ball with it. Yeah, please continue to support. Love you guys. Stay true. Bye. I'm on my way to drop off my bag in casualty. And then I'm just gonna grab some Coke. But I'll be calling at Mthatha Regional Hospital. So this is the hospital. As you can see, I've got my bag. Okay, so guys, I have bought my Coke and we're on our way to casualty now. They've changed teams, so I probably might not see the same faces I saw. So this is the admission area of the hospital, where we also take vital signs and open a file. This is the hallway leading up to casualty, A3 and recovery, and this is our casualty setting. We have about 6 to 7 beds, and the computer is our x-ray viewing computer. So this is my consultation time. So I'm currently speaking to a patient and just asking her about her symptoms, how she feels, and when it's been happening, for how long. So when we ask our patients questions, we try and give them like open-ended questions and closed-ended questions just to try and figure out a broad spectrum diagnosis so we know how to treat them. 5:12, taking a bathroom break. Guys. Right now I am drawing some medication for a patient. So before we even prescribe or give the patient medication, we have to confirm the dosage and the fact that the patient is supposed to receive that type of medication. So it's very important that we know our pharmacology. So the following are x-rays that I had requested to be taken from patients that I saw. I'll make a separate video on how to interpret x-rays for you guys. Okay, so I just came to maternity and asked if they've got cases for theater. Sadly they don't, but just got home and I want to prepare some snacking yana. So I've got noodles sponsored by Ubusi. So just before I could eat, I got a call that there were emergency C-sections. So I'm currently in theater and I'm about to do my C-section. Currently wearing a gown. So I couldn't get a lot of content for this first cesarean section that I did, but
just a brief overview. We had to book her in, and then I wore my surgical gowns underneath. But anyways, yeah, so we prepped the patient, we got her in the theater room. That's the midwife at the back preparing the baby chamber, whatever. And then you're gonna see the anesthesiologist on call who's going to be giving a spinal anesthesia. That is me. And yeah, we prepped the patient. It was a successful cesarean section. This was me having to return to A3, which is emergency and trauma, having a small snack break since I couldn't get time to eat the noodles that I got from my friend, stealing another snack, and then having to work with trauma and emergency cases. So the patient I had in front of me was assaulted by a known party with a knife at the back of top of the back of the head. So I had to go in and shave the area that had the laceration, clean, and then numb the area with a local anesthetic. As you see, I used a suture needle, suture thread, and yeah, that was me making the first knot, and this is the second subsequent knot. So we use a suture thread that is specific. This is particularly a non-absorbable since it's just a superficial laceration, it's not deep, and we try our best not to make too many sutures so that it is still aesthetically pleasing, but it's not going to be too many sutures to take out when he has to take them out. So we typically ask for patients to remove sutures in this particular area after 7 days at their local clinic. So yeah. We make non-continued sutures, so we make 1 knot, 2 knots, and then we cut, start again. So that was me having to cut with a blade. So I do not remember the diagnosis I made with this patient, only because I can't remember the history and all that I said to the patient, but I would essentially ask if the patient experienced any cardinal signs of head injury, which are your loss of consciousness for a period of time, any blurred or double vision, has the patient been experiencing any nausea or vomiting, check the pupils if they're dilated, if they have a persistent headache, and all of that. It's very important that during the procedure you do ask your patient, do they feel any pain? If so, you have to give the local anesthesia again. And typically when you do suture the region such as the head, it's very important that you at least establish a line that has Ringer's lactate 1 liter or normal saline 1 liter, just to stabilize them and to make sure that the blood loss that they do experience during the suturing does not affect them in terms of experiencing any lightheadedness. With this particular patient, she was assaulted by a known party as well on the side of her head with a glass bottle, if I'm not mistaken. So it was a bit of a gaping wound as well. It was quite large. So I had to go in with 2 types of sutures or suture threads. I had to use absorbables, so one that would absorb in her skin because it was a bit deep, which is the one I'm starting with now. And then subsequently I would use the superficial or the non-absorbable suture that would help fully close the wound and would be removed after 5 to 7 days at her local clinic. I had already given her the local anesthesia, so she did not feel pain during this process. Kept on asking her if she's okay, which she was, and if she experienced any pain, which she didn't. It did take some time. I wanted to make sure that everything was aligned. There was no mismatch with her skin. Had to make sure that I had to shave down any hair so that there wouldn't be any ingrown hairs. I was called for another cesarean section at maternity, so I went to theatre. They booked the patient and everything went well. So in a cesarean section, we typically do them if they're emergencies, if the baby is honestly not in a position to wait until full term, so if they're under fetal distress or if they're preterm. There are many indications, but the surgery is quite simple. It takes about 30 minutes. We just make 1 incision line and subsequent incisions and expose the uterus, remove the baby, make sure that it's healthy, and then suture everything back up again. So it was standard procedure for this particular patient as well. It was his second C-section. Was me being on call with a good friend of mine, Zimmy. This is a different day, but I had to add it in because we were so happy with this C-section. So we came in, we scrubbed, and we had to wait for the patient to be brought in. And yes, this is what I wanted. So I managed to get a good video for you guys so I can show you how we do a spinal anesthesia. So the lady on the left is our anesthesiologist. She's the lady in charge with making sure that our patient does not feel pain throughout the entire procedure. So she's trying to find the space between the vertebra in order to induce a needle, which you will see subsequently. And then she would wait for backflow of the cerebral spinal fluid, or CSF, which in turn she would introduce the medication needed in order to numb the nerves of the patient from the waist down. Yeah, so that is her inducing the spinal needle. And yeah, so the patient has to be positioned in a particular way. Typically we'll ask her to draw her head towards her chest in order to fully expose the vertebra, giving us a bit of opening, and then we get the right spot. So that is the doctor inducing the medication, and then we would cover the section, ask the patient to lie down, and prep her for the subsequent C-section. So once everything was prepped, the patient laid on the bed, got everything in order, and that was the surgical nurse cleaning the areas that we would work with when we perform the operation. Yeah. That is the midwife waiting with the baby chamber, and that was us assisting. So these were the surgical doctors on call with the surgical nurse as well. So we had a bit of a difficulty with this patient, but all in all, we managed to look past that and we were able to have a safe and successful delivery. So it does need a manual labor. Hey, like every time I assist, I just remember I need to really jump because it really needs some physical force. It needs some heavy physical force, but it was a success. By this period, we had already made an incision across the uterus, and now we were just trying to apply pressure for the baby to come out with ease. That is the baby's head right there, and hooray, we have a beautiful and successful delivery of one baby. So the doctor was clamping the umbilical cord in order to surgically cut, and the surgical nurse was shaking the baby across the back in order to elicit a cry so we could check the baby's APGAR score. So an APGAR score is essentially a score that we use to assess essentially how active the baby is once born. So that's not the end all be all. We also have to remove the placenta. So it is very crucial that we remove the placenta very gently because the lining of the placenta that attaches to the uterus can be retained back into the uterus, and it will cause tremendous bleeding if not removed. So once we've successfully removed the placenta, now we have to clean the uterus internally and around. We have to compress it with a towel, as you see the intern attempting to do. So we compress it so that we can reduce the size. We use gauze to also soak up any excess blood that we see, and then we clamp where we see arteries bleeding, because we don't want there to be excess blood. The moment we see blood, we have to suture. We cannot leave the patient with an internal bleed. It would be catastrophic. So yeah, that was just us cleaning, making sure that everything is spick and span. If we see a bleed, we would suture. So these were all absorbable sutures because obviously this is internal. And yeah, we did a lot of suturing on this particular patient. There were a lot of bleeds, but we managed to get her stable as we were also performing a resus at the same time by giving her fluids so she didn't experience tremendous blood loss during this period. Now this is us molding and essentially returning the uterus back into the abdominal cavity so that we can continue to suture the other layers of the abdomen. These were the final sutures completing our surgery, and that was the newborn baby. So it was around 8 or 9 in the morning the following day. I was returning to A3, and immediately I had seen a patient who was stabbed by a thief on his right wrist. Now, that was me preparing my suture pack in order to suture him. This was another patient who was involved in a motor vehicle accident, and he sustained a laceration at the top of his head, so it needed me to apply local anesthetic and suture. The patient did experience some pain, but yeah, there's only so much anesthetic I can give before I overdose the patient. So we had to nyamazel and I had to suture in order to close the open wound. Around 11 or noon, I was dog tired, Shem. So a doctor that I was on call with decided to drive and get us some ice cream because it was so hot. It was like 34 degrees. Then after that, I went to the neonatal ward because I wanted to see all the babies that we had just delivered during the course of the call from all the C-sections. So there was one very healthy delivery, had no complications. APGAR score was great. The baby was breathing on his own. So adorable with the mom. It was very, very cute to see. Guys, okay. 2 babies that were preterm, so they came experiencing fetal distress. So it was difficult for them to breathe. They were quite restless in the womb. So that's why they were incubated and given a CPAP, which is like fluid resus or resuscitation with fluid pressure. And then this was another one. He was born with a very particular rash on his body. It was a weird yellow rash, so we thought he may have syphilis, but yeah, we still have to run some more tests. Came back and I ordered some lunch/dinner because I was so hungry. KFC never disappoints. I literally almost forgot. This is a video that my good friend Zimi took of me as I was assisting in a cesarean section. I could have added it earlier, but I just thought about it now. So I'm in the middle, and yeah, that's me. OMG.
That we call it an end to our very first vlog. Thank you guys so much for supporting, watching. Please comment, please subscribe, and please tell everyone you know about the entire channel. Thank you guys so much for your support and hope to see you soon for another video. Bye.